of Parliament, my two colleagues who I have worked with many years, Your Excellency, if you allow me, Honorable Abdul Dawood of Imenti North, and our ranking member of Parliament for Kisumu West. Am I right? Kisumu East, Honorable Shakir Shabir. I'm also seeing a former member of Parliament, Brother. Is there community elders, scholars, business community, distinguished members of the Memon community, ladies and gentlemen, assalamu alaikum wa rahmatullahi wa barakatuh. First, I'll be very brief and I'll limit myself to the health pillar because I am paid to speak on health, so I don't want to speak on the other pillars. The Prime Cabinet Secretary, our leader, will do that. But I want to thank the leadership of IMO East Africa under the stewardship of Brother Shahid Yaqub for convening this forward-looking Vision 100 dialogue. And I want to acknowledge the long and the distinguished role of the Memon community in Kenya's history, your contribution to healthcare, to enterprise, to philanthropy, to social cohesion, are deeply woven into our country's progressive history. We are stronger together because of your organized, value-driven community. And this gathering is timely, is thoughtful, and it is purposefully. It speaks not only to the ambition, but to a very focused leadership and responsibility. Ladies and gentlemen, our Prime Cabinet Secretary, let me begin with a very simple but fundamental truth that health is the foundation of all our development. Without health, education outcomes will decline, because sick children cannot learn. Productivity collapses because unhealthy adults cannot go to work. Poverty deepens because illness pushes families into debt. And families disintegrate because health shocks break our social resilience. Therefore, healthcare is not only about hospitals and medicines. It's about prevention, it's about access, it's about affordability, dignity, and protection from the financial ruin that we see every day. And let me say it clearly that no vision for education, housing, or economic growth can succeed if health is weak. Every serious nation or community must place health as its core. And it is for this reason that I commend Vision 100 for recognizing healthcare not as an afterthought, but as a foundational pillar. And that's why in Kenya, healthcare or universal health coverage is a very, very important pillar of our government under the able leadership of President Ruto. So what resonates strongly with the Ministry of Health is your emphasis on preventive health care rather than crisis response, early screening for lifestyle and non-communicable diseases, mental and emotional well-being as part of holistic care, and protecting families from the catastrophic health expenditure is all anchored in our Taifa Care or universal health coverage. These priorities mirror what we now works. We need to organize our communities and invest in healthcare to reduce pressure over the overstretched public healthcare system. We must improve early detection of disease, leading to better healthcare outcomes. And let me emphasize on this principle that when communities organize, like we are doing tonight, when communities are responsible, when government systems become stronger, like our healthcare system, and not weaker, then community initiative like this one is not a competition, but is a complementary to government. Ladies and gentlemen, without making specific commitments today, I want to affirm that the direction of Vision 100 aligns with Kenya's national health care strategy. Our reforms are anchored on the universal health coverage, ensuring that no Kenyan is left behind through investment in primary health care system. The government alone cannot carry this burden. Sustainable health care systems are built on shared responsibility. Healthcare works best when government, policy, and community responsibility move in the same direction. And this is where structured accountability, community initiative add lasting value. So what is particularly powerful about Vision 100 is that it treats development as an integrated system, not isolated silos. And in closing, let me once again congratulate IMO East Africa and its leadership for the Vision 100 initiative. The Ministry of Health remains open to a continued dialogue and collaboration with the organized, principled, and forward-looking community institutions like we have seen tonight. And we value partnerships that are grounded in responsibility. We value partnerships that are sustainable, and we value partnership that aligns to national interests. Let us all remember, a healthy community is the backbone of a very strong nation, and a vision like this will help us move closer to that goal together. I wish Vision 100 all the very success, and I want to thank you for your commitment to the future of our country and the future of Kenya. May Allah bless our efforts and our nation. Asanteni sana. Your Excellency, the Prime Cabinet Secretary, when I was invited to this function, I was wondering how to write my speech. Because in the Ministry of Health, we have divisions and directorates. So there are people who are in charge of preventive medicine, there are people who are in charge of health financing, there are people who are in charge of equipment, there are people who are in charge of many things. And so when I told them I'm going to address a very progressive community, this community is very progressive. They are progressive in business, they are progressive in social and community engagement, and they are progressive in spiritual and faith. I want to confirm to that as a Muslim leader in this country. And they are very good in education, the Memon schools. I lived in Mombasa part of my life before I joined politics. So this evening, I really want to thank you because despite your busy schedule, you spared some time. You know me very well that I usually pray on my way home. I'm in my house at 7 o'clock. So I usually pray my Maghrib prayers in Parklands Masjid or Pangani. So tonight, why I stayed all this long is one, because my boss is here. So I didn't want to go into problems. Secondly, I'm here because this is a very important part of our community as Muslim leaders in our country. And more so, they are very transformative leaders, and you can attest to the two members of parliament who are ranking members, Honorable Dawoodi and Honorable Shakil. And we really want to thank you. They are part of our healthcare system. They support us in education. And just before I invite you, you know, good people, most of you are business people. And why some leaders have a problem with President Ruto is because of legacy issues. Because in 3 years, he has set a legacy transformation project in our country. In 3 years, as of last night, 29 million Kenyans have registered with the Social Health Authority. As of today, every city and every town in Kenya, we have got high-rise buildings, affordable housing. Because health care and housing is a constitutional imperative that the dignity of the citizens must be restored. So today, and members of parliament will agree with me, and you will agree with me, Honorable Cabinet Prime Cabinet Secretary, that Kenyans who were living in a room of 10 by 10 without water, without electricity, without proper sanitation, are today going to live in 2-3 bedroom houses with water, with electricity, with schools, with a playground, with a health facility. Today, for the first time in 30 years, we are building the biggest stadium, Talanta. It's ready. Today, if you go, please, when you go to the coast, just fly and see the kind of food security, the 2 million acres food security agriculture which is taking place. Today, our education model has changed. So there are leaders who are wondering how this president and vision can get the legacy in 3 years that they could not do it in 10 years, in 20 years, in 30 years. And the perception of our country is changing. I was talking to our members of parliament. Today our economy is changing. We were the first country to sign the health agreement with the US government in State Department. The first country. Today a Kenyan can walk to Aga Khan Hospital and undergo a kidney transplant fully paid by the Social Health Authority without incurring a single extra shilling. And that Kenyan, he doesn't need to be the rich. Any Kenyan, ordinary, among the 29 million. Today, the most important dialysis patients will go under dialysis twice a week. They just need to walk to any level 6 hospital, both private, public, and government, and SHA will pay for it. Today, more than 90% of our mothers are delivering in healthcare facilities because they go and the maternity and the cesarean and normal delivery are paid for. And finally, good people, my colleagues, ministers of health in Africa, are calling me every day, telling me we want to come and learn how Kenya has implemented the universal health coverage. So there's good thing going on, and that is why tonight myself and my boss, we have come here because we have seen a community that has a vision just like the President Ruto has a vision and his government. This is how the vision of our administration is anchored. That's why the Prime Cabinet, the leader of the cabinet, after the President and the Deputy President, is sitting here for all these hours. Because what we are doing and what you are doing as a community, the Memon community, and the vision and the leadership aligns. With those many, many remarks, now it's my duty and pleasure to invite my boss, my senior, the Prime Cabinet Secretary, the Honorable let me call our guest, because he was sitting next to me, so I know I've checked his name tag, so I'll not have a problem. Let me call our elder, our global guest speaker, Mr. Aziz Memon, to come and say a few words before I invite the Prime Cabinet Secretary. May God bless him. We always pray for our elders.